just healthy, and I remember the nurse reminding me to count her fingers.
We found out something was wrong with Alex the next day after she was born, when Jessica was feeding her and she wasn't taking her bottle. They get a little diagram, you know, and they tell us more. They draw a little picture, and we're like, in other words, she had only half a heart. I mean, and, you know, they tell all these medical terms, and they get down to like, she only has half a heart. Only, you know, half is functioning right. The other one's like very little, and it's not even working. It's not doing nothing. So right away, we're like, so what do we do?
Well, Alex was born with what we call Hypoplastic Left Heart Syndrome, which is a fancy term to describe that the baby's left-sided heart did not develop. As a consequence of this, the ascending aorta, the main vessel that takes the oxygenated blood to the body, fails to properly grow and becomes very small as well. So this condition obviously is not compatible with life unless there's another way of the blood to reach the distal part of the body.
The rest of the staff we really don't hear much about, but the social workers there just really lent their support to us, and they helped us with whatever it was that we needed.
Originally there was probably one of the most lethal conditions for congenital heart surgery. Nowadays, probably the survival varies depending on which institution, but it goes between 50 to 70% survival, maybe less.
The odds weren't very good, and they told us that we had three options. It was a heart transplant, the Norwood operation, or just let her go, you know, let God take her. Well, me and Jessica, we talked about it with our families and all, and we decided, you know, hey, we got to give her a chance, you know. And we did all this research, and we talked to the cardiologist there, we talked to Dr. Morales, the surgeon.
They actually were willing to, you know, put a full commitment into Alex's development no matter what.
We talked about it, and we thought, you know what, we'll just have it here in Driscoll. The day she was going to get operated, man, it was scary, you know. Here she comes in that little tank, you know. We're wheeling her down. She's at second floor. She's just there looking at us, you know, with her little eyes. You know, and we're like, this is the last time we're going to see her alive, you know. And we go down, and all the nurses were like real supportive, you know, it's going to be all right. That was the longest time of my life, right there.
I can describe it technically went very well. However, coming off the heart-lung machine, it was a little bit of difficulty separating the baby's heart from the heart-lung machine. It did made it for a little bit of touch and go for several hours.
One of the cardiologists came, Dr. Pliska, and he told us that it didn't look that good.
And the surgical repair went very well, and she did well, but there was some difficulty coming off the bypass pump. And this was explained to the family, and of course, babies with this serious of a condition, oftentimes it's very difficult coming off the bypass pump the first time. We did meet with the family and discuss that with them, told them that the situation looked very serious.
It was hard for me. My emotions were like, I don't know, to cry, or I was in shock, you know, like I'm gonna lose my little girl, you know. But I stayed there with my family, and we cried together, we prayed together, and like an hour later, you know, here comes Dr. Pliska again. She made it, you know, and we're like, what? Yeah, she made it. She made it through the operation. You know, she's off the heart and lung machine, and she's doing good right now. But he also told us the next 48 hours after that are the crucial moments, you know.
Well, even though the baby came out of surgery and was off the pump and did come into the ICU, of course we consider that a critical time when the babies are still critically ill, even though the operation is over. There's some relief that the operation is over, but that we explained to the family that this is a critical time. The first 24 to 48 hours after the operation is still a time when the baby is still seriously ill, and that there can be changes, but Alexxandra did well and progressed through that time.
So we knew we weren't out of the woods yet. We knew that it was just the first stage out of a long procedure which she was going to go through.
It was hard at first. I mean, we'd have to drive to the hospital before the sun came up, and we'd go back home after the sun had set, and it was hard to leave her. It was hard to leave Alexxandra there. At first, while we were at the hospital, we had so much support, and so much information was provided for us, and was repeated several times. You know, it's hard to understand exactly what's going on, especially with, you know, the medical jargon and all. It's just a lot of medical terms. It's hard to understand, and so the great thing was that there was a staff there that really, they'd explain it in medical terms, and then they'd simplify it for us and kind of really tell it like it was. And we had so much support, you know. The doctors were great, wonderful, and Alexxandra's surgeon is just, I don't know what we'd do without him. Alexxandra's primary nurse was just wonderful, as were the other nurses as well, but this one was Alexxandra's primary, and she took great care in helping Alexxandra get better. Just looking at her, you wouldn't
know anything's wrong with her, you know. You wouldn't know she doesn't have heart problems. And she loves the park, she loves to write, she loves to read, and she loves to hang out with her little cousin, Layla.
She's just acting like a normal 3-year-old. You just wouldn't know she's living on half a heart.
She's strong. She's a fighter.
She's doing wonderful. She is, and Alexxandra loves going to the park, and that's just her favorite pastime.
The way I feel about the doctors and nurses at your school, I mean, words can't express, you know, how much we owe them, you know. I mean, we know that everything is done by God, you know. But I really feel that he put them there to save my little girl's life, you know. They were supportive. I mean, they did whatever it took to make us feel comfortable, you know.
We're just lucky to have a hospital like Driscoll Children's and to just support us and in every way that they can, and with great surgeons and great doctors and nurses and wonderful staff of understanding people, because, you know, maybe to them they were just doing their job, but they really did help us get through what was the worst experience of our life.
I guess in my case, in my particular case, I do tend to get very emotionally involved with the patients. For good or for bad, I think that works okay for me.
That's what I really liked about the staff, was that they were honest and open, and they gave us so much hope.